NCLEX exam preview questions and answers full test. Question 1. A client is receiving heparin and warfarin after total hip replacement surgery. Lab results show an international normalized ratio, INR, of 5.5. Which priority action should the nurse take? Option A. Hold the next dose of warfarin. Option B. Monitor for bruising or bleeding. Option C. Notify the healthcare provider, HCP. Option D. Administer protamine sulfate. The correct answer is option C. Notify the healthcare provider, HCP. 3. The therapeutic range for INR is 2 to 3, therefore a client with a 5.5 INR is at a high risk for bleeding and the nurse should notify the HCP immediately. Question 2. A nurse is caring for a 2-year-old child who underwent a tonsillectomy at 8 a.m. At 11 a.m., the child has a temperature of 98.2 F, 36.7 C. At 1 p.m., the child's parent reports to the nurse that the child feels very warm to touch. What should the nurse do first? Option A. Reassure the parent that this is normal. Option B. Take the child's temperature. Option C. Offer the child cold oral fluids. Option D. Administer prescribed acetaminophen. The correct answer is option B. Take the child's temperature. 2. Question 3. The nurse is caring for a 60-year-old female client scheduled for abdominal surgery. Which factor in the client's history indicates that the client is at an increased risk for deep vein thrombosis, DVT, in the postoperative period? Option A. Past hypersensitivity to heparin. Option B. Family history of uterine cancer. Option C. Estrogen replacement therapy for the past 3 years. Option D. History of acute hepatitis A. The correct answer is option C. Estrogen replacement therapy for the past 3 years. 3. The estrogen and hormone replacement therapy, and in birth control pills, can increase clotting factors in the blood, increasing the risk for development of a DVT. Question 4. A client is scheduled for a computerized tomography, CT, scan of the abdomen with contrast. What action should the nurse take before sending the client to the imaging department? Option A. Insert a temporary urinary catheter. Option B. Confirm that a signed consent is in the chart. Option C. Keep the client on bed rest. Option D. Hold all of the client's medications. The correct answer is option B. Confirm that a signed consent is in the chart. 2. Question 5. An 80-year-old client with type 2 diabetes mellitus is admitted to the emergency department with worsening confusion and decreased level of consciousness. Which of these findings is most important for the nurse to report to the healthcare provider? Option A. A blood glucose of 380 mg/dl. Option B. Arterial blood pH of 7.363, urine output greater than 100 ml/hour for serum osmolarity of 355 mosm/L. The correct answer is option D, NAN. 4. Question 6. The nurse is monitoring a 45-year-old client who just underwent a cardioversion for dysrhythmias. The client's respirations are 12 per minute. Which action should the nurse take next? Option A. Measure the client's oxygen saturation. Option B. Ask another nurse to verify the respiratory rate. Option C. Notify the healthcare provider, HCP. Option D. Continue to monitor the client. The correct answer is option D. Continue to monitor the client. For normal respirations range from 12 to 20 per minute, respirations of 8 or less per minute would be a cause for concern. Question 7. The nurse is preparing a client for an intravenous pyelogram, IVP, test. Which intervention should the nurse plan to implement? Option A. Limit client's fluid intake to 400 ml prior to the test. Option B. Inform client that no special preparation is necessary. Option C. Instruct client to maintain a regular diet until the test. Option D. Administer a laxative the evening before the test. The correct answer is option D. Administer a laxative the evening before the test. For it is important for the large intestine to be clear of stool to allow full visualization of the kidney, bladder and ureters. Question 8. The nurse is preparing to suction a client's tracheostomy. What action should the nurse take to prevent hypoxia during the procedure? Option A. Explain procedure to client. Option B. Monitor heart rate during suctioning. Option C. Use sterile technique. Option D. Provide pre-oxygenation to the client. The correct answer is option D. Provide pre-oxygenation to the client. 4. Question 9. The nurse is caring for a comatose client. To To prevent keratitis, moisturizing ointment should be prescribed for which body site? Option A, lower eyelids. Option B, external ear canal. Option C, fingernails and toenails. Option D, perianal area. The correct answer is option A, lower eyelids. Unconscious or comatose clients are often unable to close their eyes or do not have a functioning blink reflex. When the eye remains open for a prolonged time, the cornea will dry out, causing irritation or ulceration. Question 10. The nurse is in the process of inserting a urinary catheter in an adult female client. The nurse advances the catheter approximately 2 to 3 inches, 5 to 7 centimeters, but no urine return is seen. What should the nurse do next? Option A, inflate the catheter balloon. Option B, advance the catheter a few more inches. Option C, withdraw the catheter and try again. Option D, notify the healthcare provider, HCP. The correct answer is option B, advance the catheter a few more inches. 2. Question 11. A child diagnosed with thalassemia has received several blood transfusions during the past 3 days. What lab value is the priority for the nurse to monitor with this client? Option A, hemoglobin level. Option B, platelet count. Option C, blood urea nitrogen level. Option D, neutrophil percentage. The correct answer is option A, hemoglobin level. 1A normal hemoglobin range for children is approximately 11 to 13 gm/dl. Thalassemia, also called Cooley's anemia, is a genetic defect that causes anemia, i.e., a condition in which the blood contains below normal hemoglobin levels. Hemoglobin is the oxygen-carrying protein component of the red blood cell, RBC. Question 12. The nurse initiates continuous enteral feeding at 8 a.m. at 50 ml/hour for a client with malnutrition. It is now noon. What priority action should the nurse take at this time? Option A, flush the feeding tube with 100 ml of water. Option B, assess bowel sounds and gastric pH. Option C, measure the gastric residual volume. Option D, keep head of bed elevated at least 30 degrees. The correct answer is option C, measure the gastric residual volume. 3. Question 13. A transesophageal echocardiogram, T, is ordered for a client with possible endocarditis. Which action included in the T orders should the nurse implement first? Option A, place the client on NPO status. Option B, administer O2 per nasal cannula. Option C, start a peripheral 4-line. Option D, give midazolam, versed, 1 mg 4 push. The correct answer is option A, place the client on NPO status. 1. Question 14. A pregnant woman in the 3rd trimester is admitted with a report of painless vaginal bleeding that started several hours ago. The nurse should prepare the client for what procedure? Option A, pelvic exam. Option B, abdominal ultrasound. Option C, non-stress test. Option D, cesarean section. The correct answer is option B, abdominal ultrasound. 2. Question 15. A client has been taking isoniazid, INH, and rifampin for several months. Which laboratory test should the nurse monitor with this client? Option A, creatinine clearance. Option B, cardiac enzymes. Option C, liver enzymes. Option D, sputum culture. The correct answer is option C, liver enzymes. 3-INH and rifampin are used to treat tuberculosis and both are hepatotoxic. Isoniazid can cause hepatocellular injury. Question 16. A male client underwent a hernia repair in an outpatient surgery clinic. He is awake and alert, but has not been able to void since he returned from surgery 6 hours ago. He received 1000 ml of intravenous, fluids. Which action should the nurse implement to help this client urinate? Option A, have the client drink several glasses of water. Option B, insert a urinary catheter. Option C, assist the client to stand to void. Option D, obtain a bladder ultrasound. The correct answer is option C, assist the client to stand to void. 3. Question 17. The nurse is caring for a client who had a closed reduction of a fractured right wrist, followed by the application of a cast about 12 hours ago. Which finding requires the nurse's immediate attention? Option A, serum calcium level of 6.8 mg/dl. Option B, numbness in the right hand. Option C, reported pain level of 6 on a numeric pain scale. Option D, edema and swelling of the right hand. The correct answer is option B, numbness in the right hand. 2.